Most people look in the mirror and think the only belly fat they have to worry about is a soft, wobbly roll they can pinch with their fingers. That's the fat that makes jeans tight and shirts ride up. It's annoying, it's visible, and it's what every magazine cover promises to help you get rid of. But deep inside your abdomen, hidden from sight and impossible to grab, lives a far more dangerous kind of fat. It doesn't jiggle. It doesn't show up in photos. It wraps itself like a thick, poisonous blanket around your liver, pancreas, intestines, kidneys, and even your heart. This is visceral fat, and it is silently destroying your health right now. Whether you can see it or not, visceral fat is not just extra weight. It is metabolically active tissue that behaves like a toxic organ your body never asked for. Every day it pumps out inflammatory chemicals called cytokines, floods your liver with free fatty acids, raises your blood pressure, destroys insulin sensitivity, clogs your arteries, and dramatically increases your risk of heart attacks, strokes, type 2 diabetes, fatty liver disease, Alzheimer's, and multiple forms of cancer. The truly terrifying part is how invisible it is. You can be slim, athletic, with the same size you did in college, have a flat stomach, even visible abs, and still be carrying life-threatening amounts of visceral fat. I've seen patients who run marathons, eat clean, and look fantastic in clothes, yet their CT scans show organs literally drowning in this hidden fat. They're what we call skinny on the outside, fat on the inside. But here's a discovery that changed everything for thousands of my patients. Visceral fat is actually the easiest fat in the human body to lose, once you know how to speak your body's language. In fact, when you create the right internal environment, your body will burn visceral fat first, often long before the subcutaneous fat you can see starts to disappear. That's why many people lose inches off their waist, drop blood pressure, reverse prediabetes, and feel 20 years younger in as little as 30 days, sometimes even faster. This has nothing to do with crash diets, hours of boring cardio, or expensive fat burner pills that don't work. It's about using proven science-backed strategies that tell your body, in its own hormonal language, it is now safe to release the dangerous fat around my organs. In this complete guide, you're going to learn every single step my patients use to destroy visceral fat, often losing 20 to 50% of it in just 1 month. You'll discover exactly which foods silently pile visceral fat onto your organs, and which foods force your body burn for fuel. Why, when you eat, can be 10 times more important than what you eat. Why short, intense workouts crush long, slow cardio when it comes to deep belly fat. How poor sleep and chronic stress are packing pounds of visceral fat around your organs faster than any donut ever could. And how to combine everything into a simple, sustainable 30-day plan that works with your biology instead of fighting against it. If you've ever starved yourself, counted every calorie, exercised until you were exhausted, and still watched your belly refuse to shrink, what you're about to learn will finally explain why, and more importantly, it will give you the exact roadmap to fix it forever. Let's start with the most important truth in fat loss. Not all fat is created equal. The fat most people complain about is subcutaneous fat, the soft, pinchable layer directly under your skin. It creates love handles, thigh jiggle, arm flab, and the classic muffin top. In moderate amounts, it's relatively harmless. It insulates your body, cushions your organs, and acts as a long-term energy reserve. It's mostly a cosmetic issue. Visceral fat is completely different. It lives deep inside your abdominal cavity, packed tightly between and even inside your organs. You cannot see it, you cannot pinch it, and you cannot feel it pressing against your belt, but it is actively attacking your health every single day. Because visceral fat is highly metabolic, it constantly releases inflammatory molecules, cytokines, free fatty acids, and hormones that travel straight to your liver through the portal vein. This triggers insulin resistance, skyrockets triglycerides, raises LDL cholesterol, inflames your arteries, forces your pancreas to overproduce insulin, and sets the stage for every modern chronic disease we fear. Doctors call it active fat because it never sleeps. It is literally working against you 24 hours a day. And because it's completely hidden, it's one of the sneakiest killers in medicine. Countless men and women with normal weight, flat stomachs, and healthy-looking bodies suffer sudden heart attacks, get diagnosed with fatty liver, or develop diabetes because their visceral fat reached deadly levels without ever showing on the outside. But here's what decades of research and thousands of patient scans have proven. When you finally lower insulin, reduce inflammation, balance stress hormones, and give your body proper recovery, visceral fat melts away faster than any other type of fat in the human body. MRI studies routinely show 30 to 50% reductions in visceral fat in just 4 to 6 weeks when the right conditions are created, often while the subcutaneous fat barely moves. Your body treats visceral fat as an emergency reserve it can afford to lose first. All you have to do is give it permission. Hormones are the master controllers. Chronic stress floods with cortisol, the hormone that explicitly tells your body to store fat deep around the organs in case of famine or danger. Declining testosterone in men and dropping estrogen after menopause remove natural protection against visceral fat buildup. Poor sleep destroys leptin and ghrelin balance, making you constantly hungry while raising cortisol and insulin at the same time. And the biggest lie in fitness? That doing thousands of crunches or using of machines will burn belly fat. Spot reduction is biologically impossible. You cannot force your body to pull fat from one area just by exercising the muscles nearby. Fat loss is 100% systemic, controlled by hormones and metabolism, not by which muscle you train. To truly destroy visceral fat, you must improve your entire metabolic environment. When you do, your body responds eagerly and rapidly. Here are the 5 proven pillars that make it happen. Pillar 1. Nutrition that starves visceral fat instead of feeding it. Every time you eat sugar, refined carbs, processed foods, or industrial seed oils, you spike insulin and inflammation, the 2 biggest drivers of visceral fat storage. Feed your body real, whole, anti-inflammatory foods, and those signals reverse immediately. Center every meal around non-starchy vegetables, clean protein sources, grass-fed meat, wild-caught fish, pastured eggs, organic poultry, generous healthy fats, extra virgin olive oil, avocados, coconut oil, butter, ghee, nuts, seeds, and moderate amount of fiber-rich carbohydrates, berries, lentils, chickpeas, sweet potatoes, quinoa, oats. These foods keep blood sugar stable, lower insulin, reduce inflammation, heal your gut, and directly signal your body to release visceral fat. Eliminate or drastically minimize sugar, processed foods, refined grains, vegetable oils, canola, soybean, corn, sunflower, artificial sweeteners, and frequent alcohol. These are the primary culprits that pack toxic fat around your organs. Fiber is absolutely critical. It slows digestion, prevents blood sugar spikes, feeds beneficial gut bacteria, and has been shown in multiple studies to selectively reduce visceral fat even when total calories remain unchanged. Pillar 2. Movement that specifically targets deep abdominal fat. Endless steady-state cardio is not the answer. Research is crystal clear. High-intensity interval training, HIIT, and resistance training are vastly superior for burning visceral fat. Short bursts of maximum effort followed by recovery trigger massive releases of catecholamines, adrenaline and noradrenaline, hormones that unlock fat specifically from the abdominal region. A single 20-minute HIIT session can mobilize more visceral fat than an hour of jogging. Strength training builds metabolically active muscle tissue that burns extra calories 24/7, even while you sleep. You don't need a gym membership, bodyweight circuits, resistance bands, kettlebells, or moderate dumbbells 3 to 4 times a week are more than enough. And never underestimate simple daily movement. A brisk 20 to 30-minute walk after meals dramatically improves insulin sensitivity, clears glucose and triglycerides from your bloodstream, and directly reduces visceral fat accumulation. Pillar 3. Recovery. The pillar almost everyone ignores completely. Without deep, restorative sleep and low daily stress levels, fat loss, especially visceral fat loss, grinds to a halt. 7 to 9 hours of high-quality sleep is when growth hormone peaks, fat-burning hormones rise, inflammation drops, and your body finally feels safe enough to release stored visceral fat. Chronic stress and sleep deprivation flood your system with cortisol, which explicitly deposits fat around your organs as a survival mechanism. Simple daily practices: consistent bedtime, dark, cool bedroom, no screens an hour before bed, morning sunlight exposure, deep breathing, meditation, yoga, or time in nature lower cortisol dramatically and unlock deep fat burning. Pillar 4. Timing, the single most powerful and underrated fat loss tool. Constant snacking and grazing throughout the day keeps insulin elevated for 16 to 18 hours, completely blocking access to stored body fat. Giving your body extended periods without food allows insulin to drop to baseline, growth hormone to surge, and fat burning, especially visceral fat burning, to begin in earnest. Intermittent fasting, eating all your calories within an 8 to 10 hour window, is one of the fastest, most researched methods to reduce visceral fat. Even if full fasting feels extreme right now, simply finishing dinner 3 to 4 hours before bed, skipping late-night snacks, and delaying breakfast creates massive hormonal shifts that target deep abdominal fat while you sleep. Pillar 5. Smart, evidence-based support. No supplement can ever replace the first 4 pillars, but certain natural compounds can significantly amplify your results. Green tea extract rich in EGCG, berberine, cinnamon, apple cider vinegar, 1 to 2 tablespoons in water before meals, and rosemary extract have all been shown in human studies to improve insulin sensitivity and mobilize visceral fat. Use them as intelligent boosters, never as a foundation, and always consult your physician first. Now, here is your complete, step-by-step 30-day visceral fat destruction plan. Week 1, reset and detox phase. Your only job this week is to remove the foods and habits that have been silently packing visceral fat onto your organ for years. Clear out all sugar, processed foods, refined carbohydrates, industrial seed oils, alcohol, and late-night eating. Stock your kitchen with real, whole foods only. Begin gentle daily movement, 20 to 30-minute walks, light stretching, or beginner bodyweight circuits. Lock in a consistent sleep schedule, same bedtime and wake time every single day, even weekends. Dim lights early, no screens an hour before bed. This week is about lowering inflammation and giving insulin levels their first real break in years. Week 2, build metabolic momentum. Your body is already starting to respond. Energy stabilizes. Cravings begin to fade. Clothes fit a little looser. Now add 2 to 3 short structure workouts, 20 to 30-minute bodyweight circuits, brisk walking intervals, or light resistance training. Begin gently compressing your eating window. Finish dinner a little earlier. Delay breakfast slightly. Eliminate all screens an hour before bed. Add 5 minutes of deep breathing or gentle stretching at night. Cortisol drops, insulin sensitivity improves, and visceral fat starts mobilizing. Week 3, full fat burning acceleration. Your metabolism is now highly responsive. This is when most people see the first dramatic drops in waist measurement. Increase workout intensity. Full hit sessions, example. 30 seconds all-out effort, 30 seconds rest. Repeat for 15 to 20 minutes, combined with moderate strength training. Tighten your eating window further. Aim for 8 to 10 hours if comfortable. Add a daily stress reduction practice. 5 to 10 minutes of meditation, deep breathing, or nature walking. This is usually when energy surges, mental clarity returns, and people start receiving compliments they haven't heard in years. Week 4, lock in the new normal and optimize. Fine-tune everything based on how your body feels. Most people are now effortlessly eating within an 8-hour window, sleeping deeply, moving intentionally every day, and watching their midsection shrink almost daily. Blood pressure drops. Fasting glucose normalizes. Liver enzymes improve and mental fog lifts. This is the week the transformation becomes permanent because it no longer feels like effort. It feels like freedom. This is not theory. Thousands of patients following these exact principles under medical supervision have destroyed 30 to 50% or more of their visceral fat in just 30 days, reversed metabolic disease, lowered medications, and reclaimed energy and confidence they thought were gone forever. You now possess the complete blueprint used by cardiologists, longevity experts, and top researchers around the world. The only thing left is to begin. Start tonight. Remove 1 processed food from your kitchen. Take 1 walk after dinner. Turn off your phone 30 minutes earlier. 1 small action creates momentum that changes everything. Your body has been waiting years for this signal. Give it now. The dangerous fat strangling your organs doesn't stand a chance when you finally start working with your biology instead of against it. Your 30-day transformation starts right now. Let's do this.